6 degrees of separation from Buffalo, New York, which is fantastic. So
I
it's
agree with
wonderful.
I agree with you 100%. Um, you know, when you look at unions and what they've been doing, and specifically the United Steelworkers Union, the USW has fought for contracts and they produce, better pay, better working conditions, and they certainly produce well documented benefits. And not just for their workers, but for their surrounding communities. And having a voice on the job, a collectively bargained contract, that helps, reduce problems in the workplace, that helps to get those good wages and healthcare and pensions, vacation pay. But it also benefits that surrounding community because it helps to reduce economic inequality, doesn't it?
Yeah, absolutely. And where I'm from in Buffalo, it's a small community in North Buffalo. Most of the workers worked within 10 minutes of the facility. And we all kind of went to work together, right? And grew up in that neighborhood and followed in our parents' footsteps. And, what you end up seeing is the community growing up around these factories. And the best way to be able to do that is with, good paying union jobs that talk about, future and health and safety and bargained wages. Which then rises all boats, right? And that money gets spent back in the community. And the other thing we were able to do is have a voice in safety and health when it comes to the places that we work in, right? We go to work every day for 8 to 10 hours, sometimes 12 and longer. And then we go back to the communities that we live in. So of course we want those workplaces to be as safe and as healthy as possible.
Yeah, and in addition, not only reducing economic equality, but for the surrounding areas, and that whole community, when you have union workers and they have, a successful collective bargaining sit down, an agreement is reached, a contract is signed, they have higher wages. And that raises wages for all of the industry in the surrounding area, even non-union sometimes, and certainly for whole industries. But like I said, not only the unionized facilities, right? I mean, so, unions are actually raising wages for non-union workers as well.
That's right. There's a competitiveness that employers need to have, right? They need to be able to attract employees. They all have their own groups that they meet with and talk about wages. They know what they are in union facilities and non-union facilities, and that ends up raising wages. And then, on the other side of that, as unions were instrumental in the fight for 15 and getting minimum wage passed. And there's a lot of education that needs to be done around that, especially in manufacturing sectors where you say, well, we're making way above minimum wage. Why would we need to worry about that? And having conversations saying, well, if minimum wage goes up, people have more disposable income. They can buy the products that we produce. And that will in turn, business will go up and wages will go up for us as well. And then, we also in the United Steelworkers represent thousands of public sector workers. And what that does to the community and putting money back into the community allows them to gain better wages and more stability, and helps school districts. There's many layers to what a good union community can provide for workers and families.
Yeah, the EPI, the Economic Policy Institute, has many studies on this, and one found that unions give workers a voice in shaping their communities, and that includes increased civic engagement, more focused political power for working families. It's a win-win-win all around because you have, the wages. Obviously, you're improving the surrounding community because there's job creation. There are wages that are increased, not just at the union, but also the non-union facilities because they raise the bar. But then there's more civic engagement, and then there's more power among the community, with their elected officials, or to change who their elected officials are to benefit them. And that all comes back to, again, the unions and the unions fighting for their workers. And it has that rippling effect, a positive rippling effect throughout the community with everyone.
Yeah, I firmly believe that. And, it's who's going to be there for the working class and who's going to stand up for the working class. And, whether that be Democrat or Republican, it has to be who's going to do what's best for the communities that they live in and help people provide sustainable jobs and livelihoods for their families. At the end of the day, the most important thing we can do as community members is to make sure that people can support their families and people can feed their families and send them to good, safe schools in the community. And union communities and union facilities and union workers work towards that almost in lockstep.
Yeah, absolutely. But we shouldn't be surprised. I mean, union members are members of the community. Union members not only want, you know, job creation for themselves, but for that community. Union members want everything to be better for their community, you know, across the board. Because, you know, this isn't like somebody, you know, these, you know, corporate CEOs who fly into an area like Buffalo and may not live there. These union members live in this community. They're living in Buffalo. They're living in the surrounding areas, or any city or town where the union is and the union workers are. So they have a stake in this, right? They have a stake not just in their job, but in their well-being and the community's well-being, because everything that works for them with unions, like a healthcare plan and, you know, better working conditions, that has, again, that ripple effect on the long-term health and the welfare of their community, of the place they live in, because, you know, that's why they have such a huge stake in it. It's not just about their factory and their job.
That's right. I live 5 miles from the house I grew up in. I live 5 miles from the American Brass plant that I worked in for 17 years, and my father worked in for 30, and my great-grandfather worked in for 30. Most of my friends came from the same Buffalo public school that I attended as a kid, and we're all still within, you know, really a short drive of where we all came from. And, you know, that's important to us, and there's real civic pride, and we want to make sure that when we do go back to the old neighborhood, that we're always trying to make it a little bit better, and we're always trying to attract more jobs that come in, and that goes along with a skilled and educated workforce and being able to sustain that. And I think it's very important to be able to do that to help communities out.
Oh, absolutely. It is a very powerful example of that community activism. The nurses at Robert Wood Johnson University Hospital, that's in New Brunswick, New Jersey, they were on an unfair labor practice strike for nearly 5 months last year. And the labor dispute really came down to community, how nurses could best continue providing top quality care for their patients over the long term. Staffing was a concern across the healthcare industry even before the pandemic, and obviously COVID stretched the system even thinner. Before we go to break, less than a minute, quick thoughts on that.
Yeah, this was a big important fight that you're seeing all across the labor community, right? And, fortunately for us, we have about 1,700 wonderful nurses who take pride in their job. They take pride in their community and really love their patients and want to do what's best for them, and provide the best possible care to make sure people get sent home and healthier than what they came in and safer than what they came in. And you know, this was something that needed to happen. I think it's a growing trend, and I think we'll start seeing more of that, but couldn't be prouder of our nurses at Local 200 Robert Wood Johnson Hospital.
We're going to take a quick break. We'll be back with Mr. Dave Wacera, Director of USW District 4. The website for USW is usw.org. Follow them on X and Instagram at Steelworkers, and on Facebook, facebook.com/Steelworkers. Back in a moment.
If you came across someone struggling with hunger, how would you recognize them? By their clothes, their age, the way they speak? Would you notice an 8-year-old girl who's not excited for summer break
because she may not be having lunch again until September?
Or a single father of 2 who works 3
part-time jobs and still can't put enough food on the table?
Or maybe a mother who cleans offices at night,
hoping to find meeting leftovers to take home to her hungry family.
Or a war veteran who's having a hard time
landing a job and getting back on his feet.
I am the 1 in 8 Americans who struggle with hunger. People you pass by every day but never knew were hungry. I am hunger in America.
Hunger can be hard to recognize. Learn why at IamHungerInAmerica.org. Brought to you by Feeding America, 200 Food Banks Strong, and the Ad Council.
Mama, what does the chicken say?
Chicken. Oh, okay.
When the wolf?
Oh, a wolf. Ooh!
What about the tiny dog? cat. Owl. Dolphin. What does the turkey say? Whale.
Yeah, whale sound.
Do the giraffe.
Giraffe, really? Okay. Giraffe.
You're not going to get it all right. Just make sure you nail the big stuff, like making sure your kids are buckled correctly in the right seat for their age and size. Get it right.
Visit NHTSA.gov/the right seat.
Brought to you by the National Highway Traffic Safety Administration and the Ad Council.
I'm Rick Smith, and this is Labor History in 2. On this day in labor history, the year was 1933. That was the day 6,000 workers at Briggs Manufacturing in Detroit walked off the job and sparked a strike wave of 15,000 auto body workers. Briggs made auto bodies for Ford, Chrysler, and Hudson in 4 Detroit area plants. Their pay and working conditions were considered among the worst in the nation, inspiring the adage, "If poison doesn't work, try Briggs." Earlier in the month, workers at the Waterloo plant, under the leadership of the short-lived Automobile Workers Union, struck against company-wide wage cuts and won. Their victory encouraged workers at the Highland Park and Mack Avenue Briggs plants to walk out over additional demands, which they joined in solidarity. Workers demanded the recognition of shop committees and pushed back against starvation wages. They also protested the hated dead time policy, which required workers to stay on the job unpaid, waiting for material or production lines. They wanted an end to pay deductions for tools and a worthless health insurance policy that left some with bi-weekly pay as low as 49 cents. Briggs quickly conceded to a wage increase and the end of dead time, but they would not budge on recognizing the union. As the strike dragged on, strike breakers under police escort increased, as did the red baiting of union organizers. Workers gained nothing more and ended their walkout in early May. According to historian Joyce Shaw Peterson, the walkout had been the most significant auto strike up until that point. Worker militancy and public support were impressive. As one worker recalled, after the Ford Hunger March the year before, workers took to the picket lines, facing down fears of physical injury or even death to fight for a better life. Labor History in 2 brought to you by the Illinois Labor History Society and The Rick Smith Show.
And we're back. I'm Leslie Marshall. We are back with Dave Wacera, Director of USW District 4. We are talking about not just union issues, but we've just been talking about how union members and their fights and the unions and their successes ripple throughout the community with regard to wages and healthcare and benefits, civic leadership and involvement, and political leadership and involvement in that as well. Go to the website usw.org on X and Instagram. Follow them there at Steelworkers. On Facebook, go to facebook.com/Steelworkers. Mr. Wacera, thank you for holding and welcome back. We mentioned before the break the Robert Wood Johnson University Hospital, the nurses who were on strike after unfair labor practices for nearly 5 months in New Brunswick, New Jersey. And the sticking point in that, the nurses' negotiation, really wasn't wages or health care benefits. It was enforceable, safe staffing standards. I mean, I think a lot of us have seen, certainly during the pandemic and since, there are staffing issues in some industries and, in some communities still. So that's very interesting and very specific to the point that we were making and talking about before the break, that this wasn't about, I want more for me, money or healthcare. This was literally, I want more for our patients, more staffing, enforceable, safe staffing standards for the best interest of our patients in the community. That speaks volumes.
Yeah, and listen, this is obvious, right? But for generations, nurses have always been heroes, and doctors have always been heroes. They take people at their times and live their lives to really just do everything they can to make them better. And I think we saw that even more during the COVID pandemic, but also, this is something that's going to continue after the pandemic. And what does that profession look like going forward to make sure that we have the staffing ratios that nurses deserve? That you couldn't have said it any better. This wasn't about their personal interests or bettering themselves. It was, I need more help on my job so I can help people save their lives. That's what the fight was about. It was about making sure that they were safe at the workplace as nurses and had the help that they needed, and that the patients that came in didn't have to wait for attention, didn't have to wait for care, that they could be seen quickly and seen properly, where somebody wasn't forced to rush off to the next patient, that they could actually spend time with the people that were right in front of them.
Absolutely. And, it's incredibly, obvious, like you said, incredibly important for healthcare workers and their workplace health and safety. Having enough staff helps with another systemic problem. And I think people forget, especially there was an increase during and post COVID, and that is violence in the workplace. And medical professionals certainly have their share of that, typically not coming from coworkers, typically coming from patients, whether they're high on drugs or not in their right mind. So when you have enough staff, it can prevent workplace violence, and workplace violence is a very real issue in the United States of America, not just in healthcare, but certainly in healthcare, we see a lot of it.
Yeah, and that's another part of the struggle, right? I mean, I can't imagine what it must be like to have to go into, a healthcare facility every day and, worry about saving people's lives and knowing that, you're going to face some pretty awful circumstances, but then also having in the back of your head that, something could go wrong at any moment and there could be workplace violence and you don't feel safe and you don't feel protected, but being able to make sure that you're not the only one in an area and you're not the only one in a section of the hospital where if something does go wrong, you have help there immediately to make sure that you are as safe as we possibly can be, and the situation can be handled where it gets done before it's too late and something very awful happens.
Most definitely. Also, especially in healthcare, I'm married to a healthcare professional, and I know it's during COVID, and I even know post-COVID with staffing issues, there's a lot of burnout. And if you have safe staffing and proper staffing, it can help to reduce burnout. That helps maintain staffing levels. It helps with the churn that can impact not just the workers, but certainly the patients. I don't think any of us want to go under the knife with a surgeon that's burnt out. I don't think any of us want to be treated by, a nurse, a lab technician, phlebotomist, whichever they are in the healthcare industry, if they're burnt out. Not that they wouldn't do their job well, but we want everybody to get proper rest, proper nutrition. You can't do that if you're covering 2 and 3 shifts because you don't have enough staffing and you don't want to let the patients down.
That's right. And I think if you've ever been in, if anybody's been in a hospital, which most people obviously have, whether it's for themselves or a loved one, and, you can see in the faces and in the eyes of the healthcare professionals who are just, doing the absolute best that they can but you can see that burnout in them and you feel for them because they're taking care of you or your loved one. And, I remember about a year and a half ago, my father was in the hospital and, my father being, again, steelworker and union member, the first question he had talked about was, is this a union hospital? And they said, yes, we're union workers. It wasn't Robert Wood Johnson hospitals here in Buffalo, but, that made him feel more comfortable. And he talked about the union, and they talked about to him about the fights that their union was taking on to make sure that they had all the resources available to be able to help him. And those are the conversations we should be having and talking about how we take care of our heroes in the healthcare sector.
Yeah, when we look at the nurses in New Jersey, there was a survey of nurses in Jersey conducted during the pandemic. They found that 64.3% reported burnout, 36.5% reported intent to leave the hospital within a year because they cited that they didn't have adequate PPE, they were physically exhausted, there was short staffing. But this, again, going back to the community, this is a community issue, and this is an issue of community safety, because without enough staff, healthcare workers are forced to choose where do they direct their attention. They're working through breaks. That's dangerous for levels of exhaustion. And if newer workers don't feel supported, they're not just going to leave that hospital. They're going to leave the profession entirely, and then we're going to have more of these problems in the future. So fortunately, these nurses took a strong stand. They did prevail. It took, almost half a year for that to be done. And they engaged their elected officials to set staffing levels at the legislative level. Comments on that?
Yeah, we saw some elected officials stand up and take the nurses' side and walk with them on the line. And sometimes, it's a tougher conversation because Robert Wood Johnson Hospital is a very big figure in the community. And we had to do a lot of education with elected officials, and some of them did come along. And going back to nurses leaving the profession, this strike wasn't about pay and raising wages, although we did get some raises in pay. I'll say it for them. People in the medical profession deserve to be the highest trained, best paid people in the country. They are truly the lifesavers that we go to, and we need to make sure we're setting people up for the future to be able to feed their families, but also make it more attractive to get the best possible people into this industry.
Well said. We're going to take a break. When we come back, we're going to travel down south to Puerto Rico, and we're going to talk about some union workers and situations going on there. Stick around. Like I mentioned, that Dave, director of USW District 4, he represents members across all these various states we're talking about, like New Jersey, but also the territory of Puerto Rico. More about that with him. Dave Wucera, director of USW District 4, coming up after this. Go to the website to check out more about USW, usw.org, on X and Instagram. Follow them at Steelworkers, and on Facebook, facebook.com/Steelworkers.
The Alzheimer's Association and the Ad Council present the story of Tom and Levi.
Tom is the smartest man I know. He's been a professor at 2 major universities, been a teacher for over 40 years. One day, he told me that he was having problems in his classes. I think one of the students had asked the question and he didn't remember the answer. And I also noticed that he was letting his class out earlier than they were supposed to let out. And he was telling them that he was doing it as a favor to them, but I think in reality, he just wanted to get out of there. I was really starting to worry because I saw something was wrong.
Levi and I talked about how it would change our lives, but he was there beside me, and my love for him was just immense.
When something feels different, it could be Alzheimer's. Now is the time to talk. Visit alz.org/ourstories to learn more. A message from the Alzheimer's Association and the Ad Council.
What grows in the forest? Trees? Sure. Know what else grows in the forest? Our imagination, our sense of wonder, and our family bonds grow too. Because when we disconnect from this and connect with this, we reconnect with each other and build family memories we will carry with us forever. The forest is closer than you think. Find a forest near you and start exploring at discovertheforest.org. It's easy. Just put in your zip code to find family-friendly outdoor destinations near you.
In cities all across America, an infiltration of wealthy investors, developers, and bankers is driving poor and middle-class families out of their own towns. What's at work here is the relentless financial shove of high-dollar gentrification. House by house, block by block, moneyed interests suddenly and often secretly buy up properties, bulldozing modest family homes to erect sprawling edifices for the rich. It's a profiteering money grab that intentionally prices out regular home buyers. Worse, it also artificially skyrockets property taxes for the area's longtime homeowners, forcing them to sell out and leave town. This financial whirligig is enormously destructive to a community's crucial sense of fairness and, well, community. For example, look at who likely does not live in your city. School teachers, firefighters, police, nurses, utility crews, and others who are essential to making any city work. If the so-called free market can't or won't provide affordable spaces so these families can come home where they belong, then the community itself must step up to meet the need with creative public initiatives. The good news is that many cities are doing just that, including where I live. Fed up with losing teachers who endure spirit-sucking hour-long commutes from distant suburbs, Austin's school board recently created its own affordable housing arm. It's starting to build hundreds of rental homes affordable to teachers, cafeteria workers, bus drivers, and other school employees. In addition, the district has formed a public facility corporation that partners with local groups like Habitat for Humanity to build and sell family homes at prices within the reach of the city's school employees. This is Jim Hightower saying, housing is not only a basic human need, but a community essential that can't be left to the whims and greed of developers.
And we are back. We are me, Leslie Marshall, and our guest director of USW District 4, Dave Wasura. Dave represents members across the states of Connecticut, Delaware, Maine, Massachusetts, New Hampshire, New Jersey, New York, Rhode Island, Vermont, all of New England and New Jersey and New York, but also the territory of Puerto Rico. We're going to talk about that. But first, check out the website, usw.org. On X and Instagram, follow them there at Steelworkers. And on Facebook, go to facebook.com/Steelworkers. Like and follow, and you'll get a lot of information there. Maybe you want to be one of these communities that benefits from all they do, or a worker in your workplace. Another, Mr. Wasura, another very different, although equally important example are the union workers in Puerto Rico. And they are a commonwealth of the United States, been fighting for, citizenship for years. Not citizenship, excuse me, for statehood status for years. But people forget that, they're a part of this country. They're a part of our workforce being a commonwealth. And a little more than a year ago, the governing board of the Puerto Rico Electric Power Authority voted to move forward to privatize the island's power grid. And, when you look at what happens in that section of the world, you have so many natural disasters. You had Hurricane Maria, and Hurricane Maria really exposed the vulnerability of that island, of that power grid. Since then, there have been widespread blackouts. Sometimes it lasts a week at a time. So the decision to privatize hasn't improved the system. It's done quite the opposite. So not just workers, but the entire community, the young, the elderly, are all vulnerable to this privatization of this power grid on the island of Puerto Rico.
Yeah, it's really a shame of what's going on the island. I've been fortunate enough since I've been in various positions with the USW over the last probably 10 years to be able to go to the island and on a number of occasions and sit with workers and sit with families and sit with community leaders and it seems like at every turn that they're facing more and more problems and more hills to climb. And after Maria, the devastation on the island and the years it took to really get back on their feet, in no small part to the federal government not stepping up and stepping in and helping out our citizens on the island. This decision to privatize the electrical grid and the energy source has been really bad. We're looking at austerity measures all over the island. We're not putting our communities first. And, the only way that that's going to be able to change is through unionization. And, we've just done affiliation agreements with an independent union to help strengthen their political muscle and their bargaining power on the island to make sure we can move people forward and build a more reliable power grid down there where people are the first thought, not cost.
Yeah, but people may not realize that workers in Puerto Rico began joining the USW more than 50 years ago. Municipal workers in Ponce and Juana Diaz, healthcare workers at Hospicio La Guadalupe and MedCentro, and workers at Alonso and Caras Iron Works, who supply steel for major building projects. Now, I know you guys at the USW are proud of this long, rich history with the island of Puerto Rico and with these USW workers. I know you're doing everything that you can to ensure a brighter future for the workers and for their communities. Let's talk about your affiliation with UEPI. This was last year, this affiliation with the USW and UEPI, one of the primary energy unions there in Puerto Rico, correct?
Correct, yeah. And it's really, this affiliation agreement is kind of historic of what this could look like for the future of the island. And, just to talk a little bit about our rich history on the island, when I say I've been down there and been fortunate to be there, I every time I get there, it feels like going home because you're amongst family when you're there. And obviously where I come from in Western New York, it's a very strong labor community, the Northeast, obviously, but there is a different feeling on the island with solidarity and pride of unionism that our members have down there. And they have all jumped to the forefront to help out UEPI in this fight. We're going to take a look at building relationships down there with them and making sure that they have the tools necessary to be able to go to the bargaining table, to be able to negotiate good health and safety language, good wages, good benefits, and good health care to make sure that we, again, much like with the nurses, are attracting the best possible people into these professions.
Yeah, and that's why, you guys joined with the UEPI so you could aid in the fight to upgrade Puerto Rico's energy system, so you can help workers, you can help the communities. You guys at the USW have a lot of experience in the energy sector. You have resources, you have connections with federal agencies. Can this help to modernize Puerto Rico's, not just their grid, but their infrastructure? Because obviously it's badly needed. This island constantly gets hit almost on an annual basis with the hurricanes and other natural disasters.
I think so, Leslie. I think, we have a wonderful office in Washington, D.C. with great lobbying experience. We have good connections with the Department of Energy. We can shine some lights on what's going on down on the island, make sure that the resources that are needed are being diverted there, making sure that once those resources are there, they are being put to the best possible use to be able to rebuild the infrastructure, rebuild the power grid, to make sure that every corner of the island is being touched by this renewal and sustainability of power, not just in the larger cities, but when you get into the hills and when you get into the south of the island and you get into cities like Ponce, to make sure that everybody there has the power that they need. Because then, you had mentioned we represent workers at the hospital in Med Centro, and that goes back to being able to provide quality care. You have to have reliable resources. You have to have reliable care. You have to have reliable power going into the schools to give the children the best advantage they can have.
Without question. In preparation for the show, I was looking up the privatization of the grid in Puerto Rico. Here are some of the headlines, and this is worldwide. Privatized grid unlikely to save Puerto Rico ratepayers from disastrous debt restructuring plan. Widespread skepticism on privatizing power. The privatization of Puerto Rico's power grid mired in controversy. Outrage, rekindle, and anger over Puerto Rico's privatized electric grid. And the list just goes on and on and on. And if you look up, Reuters has a great piece about what's happened to Puerto Rico's power grid since Hurricane Maria, and it's not better. Which you think, certainly, if you're gonna switch from Peter to Paul, right? you expect improvement, right? And that's not what they got. Is it fair to say that the issue of the electric grid is quite literally life and death? Because I know the Steelworkers, the USW, are proud to assist and help aid in this fight. Is it fair to say, or am I being dramatic, that this is literally life and death?
No, I don't think it is dramatic at all. It's very fair to say. And when people don't have the resources that they need, their lives are in danger. It's here in the Northeast, we talk about the cold winters and the hot summers, but there's they don't have the cold winters, but they still need to have reliable electrical because of the temperatures that come down there. Their hospitals need reliable power to be able to run the hospitals there. And, you know, we've seen all too often, whether it's you know, in some states here in America, or it's in the islands, or it's any place else really in the country, when you go to austerity measures and you start taking away resources and you stop taking away money for infrastructure rebuild, you see people suffer. And where they're suffering are in the poorest of the communities and in the hospitals, when they don't know if the lights will be on that week or not, or where's the generators going to come from, and are the generators going to be reliable, and how are we going to get the equipment we need. I think it's fair to say that when you don't have a reliable power grid, you are always in crisis mode, wondering what the next problem is going to be and when is it going to come.
Yeah, and you know, we talk about Hurricane Maria. That was 6 years ago, and that left large parts of Puerto Rico without power for months. But Hurricane Fiona, you know, that came after, knocked out electricity for many across the island. So, you know, they just keep getting hit over and over and slammed. And I would much rather trust the USW than some greedy corporations in the private sector who probably don't even know how to maintain, you know, and certainly upgrade a power grid. We're going to take a break, and when we come back, we'll continue with Mr. David Wacera. David is director of USW District 4. We are talking about lots of things. Stick around, one more great segment with him. In the meantime, go to the website, usw.org. On X, formerly Twitter, and Instagram, follow them at Steelworkers. And on Facebook, follow them, like them, facebook.com/Steelworkers. Don't go away. When we come back, we're going to talk about some legislation. We're going to talk about legislation in New York that spread to some other states that benefits all communities. We'll be back right after this.
There are a ton of social networking websites, but one stands apart for a very special reason. This one saves lives. It's MatchingDonors.com. MatchingDonors.com links organ donors with people in need of kidney and other transplants. In the U.S., 19 people die each day waiting for an organ transplant, most of them for kidneys. If you've ever considered becoming a living organ donor, or if you have someone in need of an organ transplant, visit MatchingDonors.com. Home of the greatest gift of all, the gift of life. MatchingDonors.com.
Whoa, a new digital music player. Thanks, Mom.
Oh, I'm glad you like it, because I can't wait to toss the big stereo. And now that we got your dad that big HD TV he wanted, we can throw out our old TV, too.
Hold up. You can't just throw out electronics.
Really?
They need to be recycled or donated.
And how would we do that?
It's so easy, Mom. Today, recycling electronics is just as easy as buying them. GreenerGadgets.org has all the info. We just enter our zip code to find a certified recycling center nearby. There are thousands of them, and new ones are being added all the time. Some of our local stores are even certified recycling locations.
I like that.
Did you know that some of the stuff in our old electronics could be used to make new products and conserve natural resources?
Well, okay then. Let's gather them up. What was that website again?
GreenerGadgets.org. We just enter our zip code and go.
Most gasoline now contains 10% ethanol, and that's okay. Gas with higher than 10% ethanol is not okay for your mower, chainsaw, or generator. I'm Chris Kaiser, president of the Outdoor Power Equipment Institute. What you put in your car may no longer be safe for other engines. Look before you pump. 15, 30, or 85% ethanol is harmful and illegal to use in outdoor power equipment. A consumer can find out about which fuels are appropriate at lookbeforeyoupump.com. Look before you pump. Protect your equipment. Stick with E10 or less.
Here's a clip from Tara Buster telling other Americans what other ill-informed Americans think is not news. That's why it drives me crazy about the polls when they go, oh, well, Joe Biden is very unpopular in the polls. Well, shut the up about it for once and see what happens, right? Stop saying that. Stop. How about you shut up and do some stories about let's say the $35 insulin, how it's improved Americans' lives. Or do some stories about how they're opening chips factories for once in the United States. And how that's not just good for jobs and local communities, but also national security. Do a damn story like that. do stories on how the United States is the only damn country without friggin' health care as a right. We got this bullshit of employers giving you health insurance by complete accident. Do some stories about FDR's second Bill of Rights. Talk about that, then get the panel in to discuss it. Instead of constantly giving us polls about how Joe Biden sucks, how people don't like him. They just don't, he's not, they think he's too old, even though Trump is 2 years younger and can't bend, can't do one squat, much less a push-up. Are you kidding me? But there's Joe Biden out there riding bikes. Oh, but he fell. Please, if Trump fell, he wouldn't get up. He'd be like Jabba the Hutt. He'd just transform into a slug on the ground and say, I meant to do that.
Tara Buster is recorded live every Friday evening at 8:30 p.m. Eastern Standard Time at the Tara Buster Facebook and YouTube channels. We stick together, we win.
And we are back. Director of USW District 4, Mr. Dave Wasura, joins us. We are talking with him about a lot of ways that unions help communities. If you want to help your community or you want to find out more, go to the website. USW does a lot, not just steel. USW.org. On X and Instagram, follow them at Steelworkers. And on Facebook, like and follow at facebook.com/Steelworkers. Well, before the break, I teased a little bit about legislation. And, you know, when I talk about the USW and union workers being a part of and invested and having a stake in their community, we did touch upon politics. And members do use their community-oriented mindset and their skill for political engagement to advance needed legislation. And that includes bills specifically that we're going to talk about to help veterans. You guys drafted legislation requiring employers to post official notices of the health, social, and other services that are available in order to support veterans as they build new lives on the home front. You know, I've interviewed a lot of vets from a lot of wars in my many years as a broadcaster. And one thing that a lot of them have in common is the adjustment from being shot at in a tank in Fallujah to working, in a factory or a manufacturing plant. And a lot of them suffer from PTSD or they have other issues. They're not comfortable to admit them sometimes or to talk about them. So it's of huge importance that there are notices that veterans know there are health and social and other services available to you, the veteran, the worker. Can you speak to that? And can you speak to that legislation?
Yeah, this was one of the most fascinating projects that really I've been a part of with the USW. First, I myself am not a veteran, but want to just take one quick second to thank all of the veterans that you have as listeners for their sacrifice and their commitment. And, if not for that, we wouldn't be able to do what we do on a daily basis, and just really want to recognize that and say thank you on a personal level. This legislation, really, you want to talk about grassroots. This is the example of grassroots activism that can help change lives. A few years ago, the USW started our Veterans of Steel Committee. Every district across the country, there's 12 of them, has a Veterans of Steel coordinator for the district, and they run various programs and they offer various assistance to our locals and our veterans at the work sites, whether it's in public sector or private sector or medical industry and things we've talked about in the past. And here in District 4, we have a wonderful program that's done a lot of work in the communities. We've raised money to get service dogs for our veterans. We do a program in Buffalo where we do free haircuts for veterans and free breakfast. And every year we hold, and our Veterans of Steel coordinator, Carrie Eldridge, really runs a full program on this. We do a few days where we meet in the center of our district, which is just about Albany, New York. So we go to Albany every year, and we do a few day education class and program on veterans needs and what's out there and available to help. And the way this program runs is it's not us going into a room and saying, hey, this is what you need to know. The way this program is run is, hey, what do you need from us and how can we help? And part of that conversation came up of, every time you go to work, no matter where you go to work, there is a, equal opportunity posting. There is, different postings that are required by law. Why not a veterans rights posting? And from that moment on up until Governor Hochul signed it just a while ago, the focus was, how do we write this language? What input do we get from our veteran members on what's needed? Who are our allies? And then we used it as kind of a learning tool to people who wanted to become interested in the legislative process. We brought people in not only from New York, our members from all across the Northeast into Albany to do lobbying the last cycle, and got passed a bill that required almost every workforce, every workplace across the state to post these veterans rights that you talked about. And we're seeing immediate impact because you're right, it doesn't mean somebody has to go to somebody to get help. They can look at it, they can decide for themselves and be able to find the help that they need. And our former international president, Tom Conway, and now with international president Dave McCall, has charged the directors to get the same legislation passed in every state. And we're starting to see that now here in my district. We have Maine that's passed legislation. New Hampshire, it was just introduced on the floor. It's working in Connecticut and New Jersey too. And we're starting to see it spread across the country.
Yeah, I was going to ask you about that because, I mean, first it passed in your state of New York. And like you mentioned, these are programs to help to ease that transition back into civilian life. And it is a transition, and it's not an easy one. And it also ensures those families and, in a sense, that larger community, that they are supported after they gave selflessly to our nation. We're willing to, to die for each of us that don't serve, to have the very freedoms that we have in this wonderful nation, the United States. I was proud to see the USW standing with the New York governor when she signed her state's bill into law, as you mentioned. And you guys passed it first there in New York. You mentioned it passed in Maine. It's on the floor in New Hampshire. Correct me if I'm wrong. Hasn't it passed in Louisiana and Minnesota? And there's like a handful of other states that it's being introduced in?
Yeah, we're seeing this. You're right. Louisiana, Minnesota, we're starting to see this really take off, and I'm sure it'll be coming soon to Pennsylvania. And it's the right things to be talking about, and it's a good way to engage our membership and the community, because we also had community allies that worked along with this and really show what the power of the union is. This is something that's positive, that can help people's lives and be, transformations for people. Not like, what we're seeing now in New Hampshire on the flip side of it, of having to fight right to work again. And taking benefits and wages away from workers. This is, how do we support our veterans? How do we support our members? How do we give them the tools that they need to transition back to a workforce that may be a little bit foreign to them?
Do you guys, well, first of all, this is a prime example of how this is something that I don't think people think of when they think of unions and what unions do, or specifically the USW, right? This is something that was exciting for you to work on and rewarding for you to work on. But it's important that people know about this. That's why we're talking about it today, because unions do so much, and this is not beyond the scope of what a union can do or what a union should do, and what you guys have done. I think that's awesome because, definitely there are some stereotypes or some people that just limit what they think unions can do. And you guys showed, beyond your limitations. There aren't the limitations. And, when you care about your workers, it goes far beyond. It's not just about wages or pension or health care or safe working conditions, but it's to support the whole worker, which then in turn supports the whole community.
And it's about the rising tide lifting all boats, right? This is where the conversation started today. And it's about how do we engage in our community? How do we make our neighborhoods and our neighbors and our families and our friends have a shot at a better life? And, it's why we're so involved with United Way. It's why we're so involved with worker centers. It's where can we raise our hand and say we want to be a part of the solution and it gives workers a much better shot at a better life, and communities that same shot, and school districts and our public sector workers. And it's the right fight, and it's the fight that needs to happen, especially with some troubling times maybe ahead, and workers' rights being stripped away. We have to stand up for those around us and for those that we will never meet. My great grandfather was part of the organizing campaign at our facility. He didn't know that he would have never have met the workers that are there now, but because of his activity and his vote has given a much better life for the people that I worked with.
Quick yes or no. It's passed in New York, Louisiana, Maine, and Minnesota. A handful of other states have it on the floor. You mentioned New Hampshire. Do you guys at the Steelworkers intend to keep this going until all 50 have this legislation?
All 50. That's an easy yes for us.
Thank you. Thank you for being with us today. Director of USW District 4, Dave Wasura. Like I mentioned, he represents members across the states of Connecticut, Delaware, Maine, Massachusetts, New Hampshire, New Jersey, New York, Rhode Island, Vermont, and the territory of Puerto Rico. Go to the website, usw.org, to find out more. On X and Instagram, X formerly Twitter, for those of you that still aren't used to hearing it, I'm not used to saying it, but on X, formerly Twitter, and on Instagram, follow them there. Their handle is @Steelworkers. And on Facebook, go to facebook.com/Steelworkers. Like them there, follow them there. I thank you for joining us today. I want to thank our executive producer, Mark Grimaldi, and all of you who listen and watch each and every day throughout the nation and throughout the world. Have a good one.